Hi everybody. For this week's flashcard, I'm going to be discussing impetigo, which is a condition that I've seen several times working as a pediatric inpatient nurse. However, it is most commonly treated outpatient. So impetigo is a common, highly contagious bacterial skin infection that occurs typically in infants and children. It's most common with children ages 2 to 5 years old, but rarely it can also occur in adults. The bacteria that typically cause this infection is either Staph aureus or Group A strep. So this infection spreads by direct contact to the spores or through drainage from the spores themselves. And transmission may be through physical touch, such as the hands of caregivers, or through fomites such as medical equipment, towels, or eating utensils. Another common cause of the spread of impetigo is through full contact sports, such as wrestling. After someone's exposed, it typically takes about 10 days for the sores to first appear, and treatment in the early stage involves just topical antibiotics, but systemic antibiotics are needed if the lesions are extensive. So this could be either IV or IM, which is what I've seen on my inpatient floor. Kids are no longer contagious after being on the antibiotics for 24 hours. So risk factors for impetigo include age. So if they are 2 to 5 years old, that's kind of the most common age range, as well as other infections or breaks in the skin. This could be scabies, or even if they have like minor cuts in their skin, as well as crowded conditions or close contact with someone who obviously has impetigo. It is more common in warm weather climates, such as the tropics. And then the final risk factor is just overall poor hygiene. Neonates are at a higher risk if they develop impetigo due to their immature immune systems. Neonates are also at a higher risk because of the frequency with which they come in contact with caregivers who may be carrying these bacteria. Patients who are diagnosed with impetigo who are not treated quickly are also at a risk for glomerulonephritis, so an illness in their kidneys because of certain strains of the common causative organisms of the infection. If glomerulonephritis does occur, it usually begins 1 to 2 weeks after the sores are gone. And cellulitis is another potential complication of impetigo, which occurs if the infection spreads to underlying tissue, which may eventually lead to an infection in the bloodstream. Some major common signs and symptoms are lesions that most commonly occur on the face, typically the nose and around the mouth. They start with small red sores that grow very fast and then they rupture, and there is clear to yellow drainage. The kind of hallmark sign is these honey-colored crusts. So as you can see in the picture on my flashcard, like I said, it's typically like around the nose and the mouth, and it's just this honey-colored crusting that occurs over the red sores. Kids a lot of times will have pruritus or itching and mild soreness that goes away once they start the antibiotics. And then there can be spread of an infection due to itching. So if they itch their face and then go to itch their arm, it can spread to their arm. That spread can also occur through something called auto-inoculation. So if they use a towel against their face and then use a towel against their arm or their legs, that infection can spread as well through that. So that is impetigo. Thank you for listening.